Okay, so here we are. Here we are. Well, once again, welcome all of you who are here physically present and those of you who are online. My name is David Rachal III, and I will be presenting a not a very unique topic, but this is one that is near and dear to my heart. We're talking about healthy moves, and when we're looking at healthy moves here in New Orleans, this is healthy moves for every city and state, not only the United States, but the entire world. So I'm going to come to you today and talk about exercise as medicine. Now, before I begin with this, I do want to share something with you. So for me, my background is I grew up in Natchitoches, Louisiana. So, went to Grambling State University where I got my degree in recreational therapy. Went up to Washington, D.C. I lived in D.C. for over 20 plus years. And then I decided to come back home to the state of Louisiana. And in doing so, I've learned a lot about healthcare and fitness across the board. And one thing that stands out that is very apparent is that for the most part, we are working in silos. And my theme for 2024 has been team. It's an acronym that we're all familiar with. It's together, everyone achieves more. And so when you have healthcare professionals and fitness professionals who are qualified to work together, you begin to create a you have not just the doctor carrying the burden of the nation's healthcare on their shoulders. You have an extension of professionals that can carry some of the weight. It's almost like Batman pulling in Superman. I mean, these two superheroes, they work together. And I really want to make sure that as we talk about this subject matter of exercise as medicine, we do this from the perspective of teamwork. So today, I want to talk to not only the doctor, but I also want to talk to the patient, because it's important that we understand how these dynamics have worked. But then as we get started, I want to share something with you. And this is something that we've all become accustomed to. And this is how we work in today's society. So let me get my PowerPoint going. All right, so disclaimer. All right, the following video is for illustration and entertainment purposes only. And I will say this again, this video is for illustration and entertainment purposes only.
The following is a paid commercial message from Old Laboratories, the makers of Africa. This infomercial is designed to help you make informed, educated choices regarding your prescription medicine. Recent research has determined that people who suffer from consistent and constant gassiness are 3 times more likely to be embarrassed in public, and are not only harming the atmosphere and the environment, but they're also putting loved ones, relatives, and friends at risk by repeated exposure to harmful and toxic butt gas. That's why Old Laboratories developed acetol, the once daily gas reduction medicine designed to take the stink out of daily living. Acetol works by removing the enzymes from digested food that create trapped gas. And in recent studies, 9 out of 10 patients who used acetol on a regular basis say they now poop half as much. But acetol may not be safe for everyone. Only you and your doctor can determine if acetol is right for you. Common side effects include an increase in homosexuality, blatant hostility toward animals, unexpected bowel movements, anger, depression, dysplasia, suicidal thoughts, and tendencies of uncontrollable anxiety, followed by still more anxiety, loss of appetite, speeding while driving, and loose morals. You should not take acetol if you walk, jog, or ride a bike. People who bake pies or write on chalkboard, use deodorant, detergent, red dye number 3, 7, or 8, or watch more than 2 hours of TV a month should avoid acetol without consulting a qualified medical doctor, and not necessarily your friend, the nurse. People who use acetol for more than 3 months may even develop the runs, rash, rectal bleeding, and enlarged butt cheeks, tendinitis, tennis elbow, 10 little Indians, tetanus, typhoid fever, and become cross-eyed. Do not use acetol if your tongue, ears, or nose swell. If you have shortness of breath, bad breath, loss of breath, trouble breathing, sleeping, eating, or speaking in tongues, Other side effects include constipation, clubfoot, lockjaw, web fever, nasal infection, leprosy, bleeding of the esophagus, uterus, or spleen. Women who have been pregnant or may become pregnant should avoid hitting a crack pipe or taking multiple shots of tequila. If you or someone you know is pregnant, if you're considering pregnancy or even thinking about the possibility of pregnancy, or if you have a history of pregnancy in your family, you should only take acetol if there are no signs of severe psychosis present when starting this medication. As with all medications, you should carefully read what the American Medical Association has to say about untested medicines or medicines that are manufactured in shabby third world countries such as Bangladesh, Bulgaria, Somalia, Burma, Botswana, the Lesser Antilles, and Poland. In rare cases, acetol has resulted in permanent brain damage, fallen arches, prolonged sneezing, fainting, clinical depression, virility, mobility, confusion, concussions, contusions, with an occasional death here or there. If you can't afford acetol, you can consider refinancing your home or applying for medical assistance through a local charity or government agency, because the old one doesn't give handouts and there's no free subsidy. Your health and your happiness is important to you and your family, but remember, be cautious taking drugs, because it's better to have no acetol than to put your health at risk. The 7-page disclaimer printed on every small bottle and every box of acetol should be read, and we even offer free reading glasses with a mail-in rebate to help you with that. If you're willing to risk all these possible consequences, ask your doctor to recommend twice daily or once daily acetol for you today. Take the stink out of daily living. Food less with acetol. Acetol is a non-narcotic, non-habit-forming, non-effective mixture of carbocarbophenodendarine and sulfodium boxtite inebriol, and should be kept out of the reach of children or comatose bed patients and older people who are just barely alive anyway. Acetol, once daily or twice daily for a cleaner, fresher, more tolerable you. Food less with doctor-recommended acetol. It might kill you, and it might not.
So, I share that with you because, was that a long commercial? It was definitely a long commercial, but then also the commercial was offensive. It was eye-opening and borderline an insult on intelligence. And we're constantly being bombarded with these types of infomercials, on a regular basis. And as we look at prescriptions that are being prescribed and filled, not only in the United States, but around the entire world, you take a look at what are we really doing? I mean, with the number of side effects that come along with every pharmaceutical drug that's on the market that you can think of, that you've definitely heard of on any commercial. Think about what are we doing? I mean, we're addressing a symptom in order to feel better about this one symptom, but then look at the side effects. They create another health concern. So you'll hear a lot of professionals talk about sick care versus health care. And, and addressing just simply systematic issues with the individuals, you never get to the root problem. So as you take a look at what I have in front of you, the 20 most filled prescriptions of 2022, this is the most updated list that I can get. I'm pretty sure most of you look at this list and you recognize quite a few of these. Either prescribed to you or prescriptions, exercise is not one of them. So I tried to track down when Dr. Butler actually said this, and believe it or not, AI, as smart as it is, has not been able to come up with an exact answer. It says it probably would happen within the 1980s or 1990s, but as you look at it, this statement was made 30 to 40 years ago. And it says if exercise could be packed in a pill, it would be the single most widely prescribed and beneficial medicine in the world. So as we just took a look at a list of the top 20 most filled prescriptions in the United States, Why wasn't exercise one of them? I mean, this has been an initiative with several organizations, including the American College of Sports Medicine since 2007 at the very least. But yet, exercise has not to this date topped into the top 20. And that list goes on. It's not even in the top 50. So I want to bring an awareness as to understanding, why we are where we are right now and how exercise, when used as medicine, can be beneficial to not only doctors, patients, but then also payers as well. So we all know the struggle is real for doctors. All right, so given the price of sneakers, I mean, some doctors are concerned that prescribing exercise could lead to financial stress and want to stick to medications that are covered by insurance. So, I mean, think about it. I mean, although meant to be funny and humorous at the same time, there are financial concerns that come along with exercise that, doctors may not think that, hey, my patients may not be able to financially, get a gym membership, get, the appropriate shoes or athletic support to make sure that they can exercise in a safe manner. So these are things that you want to think about in terms of, there's a struggle out there for doctors, but there are 5 common reasons that doctors may hesitate and prescribe exercise as medicine. And with these 5 items, I just want to make a disclaimer. These are topics that I've personally discussed with physicians over the last 10 years. So one, lack of time. We all know that doctors have an extremely short period of time to spend with each patient. The average doctor visit is 7 minutes. So that's been well documented. So of course, in recommending exercises, something that historically have not been included within their curriculum to become physicians, they don't have the time to really invest into prescribing exercise. And so, of course, with that being said, we look at the lack of training. So while they have extensive medical training, exercise prescription isn't always a focus. And so you can't blame them. This is not a blame game or anything along those lines. This is more of an awareness piece where we know that some aren't just simply confident in prescribing exercise. So then 3, we look fear of liability. So because of the lack of training, the lack of education, some worry about that recommending exercise without a thorough assessment could possibly lead to some sort of liability. And then you further that, whereas some patients will, hey, why don't you just recommend I go work with a trainer? Well, you know what? Here's the thing about personal trainers. And I say this with an air of honesty. Not all trainers are qualified. You can anyone can go online and become a certified personal trainer. That does not mean that they are appropriately trained and educated on how to work with special populations. And when I say special populations, every personal training certification is geared towards working with every personal trainer, an apparently healthy individual. So if you're not healthy per se, dealing with several medical conditions, and we know that most people are dealing with, one or more chronic conditions across the nation, the liability placed on a doctor for recommending their patient to go see a trainer is just too great to take that risk. We're also looking at patient compliance, encouraging patients to go exercise when, at the end of the day, it may not be convenient. There could be transportation issues. There could be childcare issues. There could be so many different issues that prevent patients from exercising that all these variables can't possibly be addressed through one doctor's visit. And then you have the belief in medication. Well, it's an unfortunate thing, but we know that Big Pharma definitely funds a lot of the educational resources that physicians use in schools today. So with that being said, we want to make sure that we understand that doctors are just simply not prescribing. They're sort of handcuffed. But then as we move forward, we need to understand that the struggle is real for patients too. So for patients, guess what? How many of you have those friends that are constantly inviting you to happy hour? All right. So constantly invite you to happy hour. It's rare that she's like, hey, brother Ron, let's go work out. That you get that invitation. That one rarely comes. Then you also have the gym. I mean, the gym is haunted by dead New Year's resolutions from the past. All right, that never came to fruition, but they just linger in the gym. So, for those of you who are superstitious, you may not want to go in the gym. Let's not forget them kids. All right, them kids, woo, they not like the ones, they not like us. I say us. I'm speaking in terms of Generation X, the kids that grew up with the lock keys, and so we knew how to behave ourselves. But them kids these days, it's hard to understand what goes through their minds. You also have the fact that some patients are in a long-term relationship with their comfort zone. All right, so they're very committed and they don't want to let them down. So they're just going to stay within that comfort zone. And then you have, those patients who are conducting, highly scientific studies on office chair longevity, and movement could skew the data. So you want to think about these things in terms of, there's, genuine struggles out there. And once again, I like to bring an air of humor to, something that, is definitely concerning across our nation. But we know there are 10 proven benefits of exercise. And there's even more, but I just want to focus on the top 10. So with that being said, let's get into it. So heart disease. All right, heart disease is definitely an area where exercise can definitely improve the lowering of blood pressure, cholesterol levels, and enhancing overall functioning of the cardiovascular system. We also have type 2 diabetes, where we know that even type 2 diabetes can be prevented and or reversed with appropriate exercise and nutrition. We have hypertension or high blood pressure, where exercise can lower blood pressure by strengthening the heart in order allowing it to pump more efficiently. We have obesity. Exercising is a cornerstone of obesity management, helping to burn calories and making sure it improves metabolism, build muscle, and aid in weight loss and maintenance overall. We have osteoarthritis. We know that individuals who perform regular moderate exercise can actually enhance mobility, reduce the amount of pain at those joints, and improve quality of life. We have chronic obstructive pulmonary disease, or COPD. Tailored programs can actually help with breathing, reduce symptoms, and enhance the ability to perform activities of daily living. Depression and anxiety. Exercise in itself for me, and I always use myself as an example, without exercise, I would not be able to handle the day-to-day stress that I experience, not only as a Black man, but as a leader, as a father. These are things that I go through on a daily basis, and exercise, in fact, is my medicine in handling both anxiety and depression. So chronic kidney disease can improve, of course, physical functioning, reduce inflammation, which is very important, and the progression of kidney disease. You have chronic back pain. I know a lot of people deal with chronic back pain, and it's because we're dealing with a new pandemic, and that's the pandemic of sitting. Sitting is the new smoking. So when you sit for long periods of time, the likelihood of you experiencing back pain goes up tenfold. So these are things that we want to be aware of because of the the restriction of sitting. And of course, we want to take a look at, all right, oops, can't see my last slide. Well, I'll come back to that. All right, so my apologies for that with the transition. But what if it was possible for, one, patients, all right, to actually receive exercise prescription directly from their doctor that can be done, all right, anywhere and covered by insurance? That is something to think about, because when you look at exercise being covered, we're not talking about a gym membership, because you can have a gym membership. That doesn't mean that you're actually going to attend the gym membership. And then once you're at the gym, even if you do attend the gym, who's to say that you're going to do the appropriate exercises that are going to benefit your medical condition? So having that prescription directly from your doctor, knowing that this exercise program is medically enhanced to improve your overall functioning level, whether or not it be cardiovascular, metabolic, or pulmonary, this is actually possible. So providers, what if it was possible for, as a provider, you could confidently, all right, prescribe, monitor, and manage with minimum time and effort exercise as medicine to your patients? Of what value would that be to you? And although I don't position it here, you can actually do this and seek reimbursement for your time and effort. This is something that's actually possible as of this date. So for payers, increased access to care while decreasing the cost of chronic care management by 20%. There are multiple studies. The data is available. It has been proven that increased access to care benefits the whole. And by digital therapeutics, you can actually get this type of care to individuals regardless of their location. It's called remote care. And remote care became very popular when the pandemic hit. And this is what we were relying on for the majority of us, unless you were in an emergency situation, to receive that sort of care. So these are things that we want to think of. All right, what if it was possible? Well, guess what? The what if is no longer there, because guess what? It is here, straight from Sweden. I have been honored to work with a company by the name of Vitala, a very influential company that has proven itself in Europe and overseas, and is bringing its technology and its business strategy here to the United States. Now, of course, with all respect to those of you who are watching, this is something that I believe in. And when I say I believe in, this is something that comes with checks, with facts. And so it's very impressive in regards to Vitala. Since going live, it has been integrated with over 125 providers across Europe in less than 12 months. Now, this is in fact impressive. And we know historically, most European nations have excelled when it comes to healthcare for their population. So, when in Rome, do what Romans do. We want to learn by how can we become more efficient with our healthcare, and Vitala presents that. It is the #1 software for preventative health care and prescribed lifestyle interventions with a focus on physical activity and exercise. The #1 in Europe. So that in itself speaks for itself. And after using Vitala, healthcare providers in Sweden increased their physical activity recommendations and prescriptions by 850%. Just think if our doctors gain access to Vitala and we're able to prescribe exercise, that provides increased access and that decreases our healthcare costs by 20%. When I say 20% on the average, we're looking at, for chronic care and management, we're looking at approximately $10,000 spent for every patient on an annual basis. To reduce it by 20%, that's $2,000. Think about what we can do as a nation with an additional $2,000 per patient that's being treated for chronic conditions, if in fact they were to be prescribed exercise and they engage on a regular basis. Vitala is also part of the world's largest randomized controlled trial on physical activity intervention for breast cancer patients. So this is huge. We know that every October we make a point to bring awareness to breast cancer, and it is something that has been plaguing not only the United States but the entire world. But exercise has a direct impact on the prevention and or improvement of most cancers, upwards of 2/3 of them. Expanding into the United States, Vitala is coming. All right, they're already here. When I say coming, I mean they're coming from coast to coast. So they already have partnerships with the Texas Medical Center, New York Presbyterian, which is extremely large, one of the largest academic medical centers in the world. All right, Roper St. Francis Hospital, and they're working on a collaboration right here where we're being hosted with Amerihealth. So these are some positive across oncology, cardiology, metabolic disease, and psychiatric care in Europe. So with that being said, patient compliance, which is very, very, I know it's something that most doctors look at. Okay, well. Population All right. Can someone give me a thumbs up to see whether or not there is audio? Yes, we're back. You gotta love it. Gotta love it. Gotta love it. Well, welcome back. I'm still here. You know, that's what happens. You never know who's listening. So I think that maybe a pharmaceutical company heard what I was saying because I am streaming this on Facebook Live, and they sabotage me. They cut my access. But we're gonna keep rolling. We're gonna keep rolling. All right. All right. So let's do this. Let's get my share back on. All right. Okay. So here we are. We're back. Can we have audio? All right. Wonderful. Wonderful. Thank all of you for your patience. So we're gonna pick back up. So once again, 80% compliance. That's huge because even in my past life as a personal trainer, getting your clients or patients to comply with your recommendations can be quite challenging because at the end of the day, life happens. But this platform has have a proven record of actually getting 80% compliance, and you know that's no small feat. So getting that type of compliance is amazing, and this is what's available. So how does it work? All right, so it's very simple. When I say very simple, there's two steps to this. Step one, the provider provides a prescription through the Vitala Care Portal. This process, all right, will take maybe 3 minutes, if that. The patient then receives a download link where they can actually download the app and access the prescription through a secured login. And everything, of course, is HIPAA compliant and certified. Then step two, the patient actually follows the exercise prescription and they're logging in their progress, they're exercising as prescribed, and then of course, the healthcare provider monitors the patient and manages their prescription. So all this can be done remotely with the access from your mobile phone. Very simple. So then when you look at the time frame that's associated with, like I said previously, 3 minutes. So if we're looking at the average doctor's visit being 7 minutes, all right, Vitala only needs 3 minutes of that for you to prescribe exercise for your patient, to use exercise as medicine. And then, of course, we're looking at 20% of a reduction in healthcare costs for these patients on an average. So when you're looking at this, of course, with physicians, they're looking at, okay, well, this is time. Time is money. And we know that this is, a harsh reality of physicians and the position that they're in. They have to make sure that for every patient that they're seeing, that there's some sort of financial revenue coming in with that. Well, rest assured that with the current state of remote therapeutic monitoring and chronic care management, there are reimbursements that can be tied to the use of Vitala as a tool for remote therapeutic monitoring and chronic care management. So there are two implementation strategies. Now, as I'm talking to you as patients, and then also I know that there are healthcare providers that are on here. I'm talking to both because we need to make sure that everyone understands the benefit and how this works in collaboration. So I already have this workout. So there's two business models that I want to share with you. Business model number one, all right, a doctor's office, a clinic, a hospital. They identify the current staff that will serve as the qualified healthcare professionals, the QHP. Now, I know some of you are thinking, okay, well, I can get my personal trainer to do this. We're going to get into that, but that is not something that we can actually explore at this time, and I'll go into further detail. But a doctor can actually prescribe the exercise as medicine through Vitala, prescribe the program, and send it to the patient. Now, a QHP can be a nurse, it can be a physical therapist, it can be a medical assistant, it can be someone who is qualified and clinically qualified to actually oversee or to monitor or manage the patient through Vitala for 20 minutes over 30 days. So as we can look at this, 20 minutes over 30 days is not a lot of time to monitor a patient, but the insight that physicians can get from monitoring patients through Vitala can be very beneficial in terms of their chronic care management, all in all. With the conclusion of 30 days, the physician and the practice can actually achieve, reimbursement. So they can apply for reimbursement through remote therapeutic monitoring or chronic care management. So that's all done in office. So that can be a one-stop shop for prescribing exercise of medicine. The second business model is one that's a little bit more along the lines of what I do and what I promote. And that requires collaboration. Going back to what I mentioned in the very beginning, team. Together, everyone achieves more. So a physician's office, a clinic can actually partner with very specific people. And I'm going to outline these people. A ACSM, American College of Sports Medicine, Certified Clinical Exercise Physiologist, CEP, or an American College of Sports Medicine Exercise Medicine Credential Professional, or an ACE Medical Exercise Specialist, or a Healthy Fit Medical Fitness Practitioner. These are the four qualified individuals, qualified healthcare providers and practitioners that can actually serve as a complementary asset to the practice or the physician. They can actually do the monitoring and managing of the patient through Vitala while allowing the physician's office or the doctor to be the billing provider. So they can do this and reimbursement can still be established. So this model in itself, and while it's one of my favorites, this model actually helps with employing more students that are going to our colleges and universities across the United States. They're getting their degrees in exercise science and exercise physiology. But yet when you go to wanted, ads, you go to, Indeed, you see personal trainer on a regular basis. You don't see exercise physiologists as often. And with that being said, we have to think about as a society, we have these kids at a rate of 30,000 plus kids per year. And I say kids, but when you look at the job opportunities, they get a degree that is $40,000, $50,000, $70,000, and yet they're going to these gyms to work as personal trainers, making very minimum, but yet they're not actually establishing careers. So that in itself is a problem. It's hard to go into a gym and make $20 an hour and expect to be able to pay your student loans back. the math is not adding up. And so physicians have a very unique opportunity to employ these students who are getting the ACM, the ACE, and the Healthy Fit credentials to become medically qualified to assist in these programs. So this is where the team comes in, and this is the solution that exists today. So it just requires a little collaboration, a little teamwork to move this forward. So for patients, all right, going back to the commercial that I showed you at the very beginning, ask your doctor if exercise medicine is right for you. Just like on every commercial, ask your doctor, have that conversation with them, because there are very little to no downsides to exercise. Yes, I know a lot of people don't like to sweat, but hey, that's part of it. When you push yourself, hey, it may not be comfortable, it may not be fun, but just like taking medicine, taking pills, that's not fun. So you do what you have to do so you can do what you want to do. And doctors, I ask this of you. Ask yourself, can we really as a society afford not to prescribe exercise medicine? Knowing what we know now, because one thing I've always said, when you know better, you can do better and you can be better. And we can actually be better as healthcare providers. We can be better in terms of our healthcare delivery across the nation. So ask yourself, can you afford not to prescribe exercise medicine, knowing that you have a viable option with Vitala and a digital therapeutics software platform as a service that you can actually provide these services? 2, contact us. Contact us about getting started. It is a very simple process, whereas we would even allow you, and I say we, I'm speaking on behalf of Vitala, to pressure test. Use the platform for 2 months to see what kind of progress and what kind of benefits your patients will acquire through the use of exercise as medicine, and give us feedback. We're willing to work with any and every physician, practice, regardless of the size, hospital system, even healthcare plan, to actually demonstrate the benefits of how prevention can be profitable for everyone involved, for the patient, the provider, and for the payer. With that being said, I want to thank all of you for joining us, both in person and online. My name is Rachal III once again, and I am the U.S. Strategic Advisor for Vitala. Thank you very much. I'll be more than happy to address and answer any questions that may come up in the chat or here in the audience.
One observation. So I definitely think, moving around and exercise is one of the most important components to, living a healthy lifestyle. But has there been any studies on the new processed foods that's one of the brand new things that have been introduced that wasn't around with So I'm wondering if that also has something to do with how it's messing with our body.
Gotcha. So for those of you who may not have heard that, the question is essentially asking about are there any studies demonstrating the impact of processed foods across the nation? And of course, the answer to that is yes. There are plenty of that. It falls outside of the scope of my expertise, but I do know, and I'm definitely aware of those studies that are out there. So they're definitely out there, and it's something for everyone to be aware of, because nutrition is number one. And I will always say that, as an expert in medical fitness, nutrition is at least 80% of your fitness or health results. You fail nutrition, you fail, period. So it's something that takes a large consideration in terms of whether or not you're going to improve your health or you're going to continue on decline. A great question. Yes, sir.
With respect to the medication, by medication that were I recognize one. I was on it for a while. Going through the process, certain doctors seem to prescribe certain things, because now the doctor that I see now is the medication that I was taking, I should get off of.
Okay.
Metformin.
Okay. Yeah, it's sitting at number 20. Metformin.
Doctor said that's best. Other doctors recommend. So, it just seems to be a conflict or matter of opinion in industry,
Mhm.
doctors, which medications work, which don't, or maybe they get benefit from prescribing.
Yeah. Yeah. So one thing I'll summarize the statement that was just made. Mike was speaking of the fact that he was prescribed metformin and that he was on metformin, and he's received conflicting views from varying doctors about metformin. And this happens with almost every medication that's out there. We have to realize that at the end of the day, when you come into your physician's office, they definitely they go through a parameter of questions that they ask you. They do their test, and at the end of the day, what they're doing is called a hypothesis. All right, they're making their best educated guess based on the data that's in front of them, and that's why you'll always hear physicians say, "Let's try this." That's what they will say. Let's try this and see how it works, right? Because I mean, this is what we're dealing with. I mean, yes, there's evidence-based, prescriptions and medications and pills and things of that sort. Those all exist, but you never know for certain how it's going to respond within that individual. Why? Because our DNAs are as unique as we are. So you never know how they're going to respond to that medication. And that's why the follow-up is always important. The communication with your physician is that crucial to make sure that they understand what's going on with you. They need that data, and sometimes the distance between that visit and your checkup, I mean, we're looking at sometimes, 90 plus days. All right. And if it's creating an adverse effect to your health, that in itself creates a problem in itself. So through a program and using digital therapeutics like Vitala, all right, a physician can monitor, your progression or lack thereof on a consistent basis in between those in-person checkups. Yes, sir. Mm-hmm. Mm-hmm. Gotcha. Yeah. 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 Mm-hmm. Yeah. Yeah. No, I thank you for sharing that. So, just in case you couldn't hear online, he was just simply sharing the fact that, yeah, he was in that situation where he was using a prescribed medication from his physician, and it just simply wasn't working for him. So, had to go back to the drawing board, per se. All right. Great comments, great questions. Anyone online? Okay, cool. All right, so I got a question from Dr. Coleman. All right, thank you for sharing important information. COVID requires us to change the way we educate students in the field. What advice do you give academic leaders and colleges and universities to help our students become competent, compassionate, and ethical, and ethical physical therapy and healthcare practitioners? Great question, Dr. Coleman. With that being said, the pandemic changes. I mean, for those of you, I have an affinity for superheroes, but for those of you who are familiar with Marvel, all right, and of course, looking at the Avengers, the pandemic and COVID came through like Thanos. I'm like, there was no solution for Thanos with the Avengers, and there was really no concrete solution for COVID. And so, this in itself was something that we were all experiencing together. It was a new learning experience as a world. I mean, we learned COVID together. This pandemic truly hit us hard. It made us realize that, guess what? Prevention and preventative medicine is important. All right. However, we have to be more proactive, not only as individuals, because we were looking at, at that point, because we were in a dire situation, we began to look at preventative measures. We were looking at herbs, supplements. The pharmaceutical industry became reactive in regards to creating medications that could prevent, the vaccines or, treat. We're always reactive. a proactive approach. And so in doing so, we have to take a look at, okay, together, how can we actually create solutions to be more proactive versus reactive? So that's what I typically advise leaders within healthcare, because the reactive approach has not worked for us. You're looking at, over the, $4.1 trillion that we're spending on healthcare. The majority of it, I think it's, and I hadn't looked at the numbers, 60% of it or more is that on chronic conditions. And when you look at chronic conditions, these are conditions that can be prevented by lifestyle choices. So these are things that as healthcare professionals, we need to make sure that we're educating and creating more of an awareness of the results of our actions. So of course, you have our actions, but then also, eating better. Nutrition is a big part of it. And you have nutrition deserts. You have individuals that may not have access to healthier foods. We know that there is a burden of costs that come along with healthier foods as well. So these are all variables that awareness and education and application is going to be very important. How do you go about eating healthy without feeling that you're stretching your budget so thin that you have to sacrifice other areas within your life in order to eat healthy? So these are things that, of course, we're looking at across the board. All right, let's see. All right, thank you, Dr. Coleman. Any other questions? Okay, so the question is, what if you have health issues that don't stem from nutrition? Okay, all right. So these are things that could be hereditary. So when you look at DNA, all right, DNA is very, very important to understand, but taking it a step further from DNA is epigenetics. So epigenetics is understanding how your environment will actually assist with gene expression. So when you look at gene expression, there are certain things within your environment that can actually trigger a gene expression to either, let's say, for instance, you have a gene that's been lying dormant and you ate a food that you've never eaten before, and all of a sudden your health increased tenfold. It improved. Why? Because that gene was turned on. It was expressed by nutrition. And we know that medicine came about through food. All right, Hippocrates, let thy food be thy medicine and thy medicine be thy food. So I use that as an analogy because there's certain things that are within your genetic code that through the exploration of that can actually help you out with understanding what genetic factors you have and what things you can actually do to either switch off or on these genetic expressions to improve your health. Okay, great question.
If it's genetic, but then it's also a lot of health issues from someone being a woman dealing with I guess childbirth. And like you can't go away from that. Like eat healthy, but they decide to do all these things, and then the health issues and the surgery come from childbirth.
Well, okay, so the question is, what about whether or not health issues are stem from being a mother and giving childbirth, postpartum issues that come along with that. That in itself is not, and I'll be honest, it's not an area of my expertise. And so, working with your specialized doctors that would, OBGYN to help out with figuring out how they work, or even a medical fitness practitioner or, someone who specializes in that area could possibly help you out with understanding how to address some of those things. But there's no one answer to dealing with, your issues, but that's where team comes in. Collectively, if you have a team working together, multiple heads are better than one, so they could collaboratively come up with a solution for you that could possibly help you out. Okay, but I definitely want to always encourage teamwork and collaboration among healthcare providers. All right, any other questions online? Thank you, Don. Thank you, Dr. Coleman. Thank you, Dr. Griggs. All right, well, What I would like to say is thank all of you, especially I want to give a special thanks out to Amerihealth for hosting this event, and of course Kim as well. She's the director here at the Gentilly location. So thank you, Kim, for everything that you've done. Thank you for Amerihealth for allowing us to do this. I want to thank Vitala for giving me an opportunity to represent the organization in bringing exercise medicine to the United States and helping with expanding it. I also want to thank the American Diabetes Association, as they are also, well, not a corporate sponsor or anything along the line. They are a supporter of exercise medicine. And so these three organizations are working together on the bigger goal. And it just ties into teamwork. All right, together everyone achieves more. I thank all of you for joining me. By all means, you have my information. So if you have additional questions, comments, or concerns about the presentation, or you want to reach out about seeing how you can expand exercise and medicine to your areas, please get in contact with me. I'd love to get you a demo, help you with understanding how the care portal, works, how the mobile app works, and bringing this to your city. So thank all of you for your time on this Saturday morning, and have a blessed day.